Welcome to your Employee Benefits Overview video provided by 208 Benefits. The information provided in this video is to help you understand your benefit options, pricing, and how to complete your benefit elections prior to your open enrollment or new hire completion deadline. Please watch and share this video with anyone that helps you make your employee benefit decisions for you and your family. You can refer back to this video at any time during the benefit plan year. First, let's review your benefits and then walk you through the features of your benefit information website. ProTouch Cleaners offers all employees working 24 or more hours per week the following benefits: medical insurance and short-term disability, accident injury insurance and life insurance, dental and vision. Medical insurance options are through Regions Blue Shield of Idaho. Before we begin to review the plan options, let's review a few terms that you should know. First term is a copay. It's a fixed dollar amount that the plan member pays for specific medical services such as a doctor's visit or a prescription purchase. Deductible is the amount a plan member is responsible for before the health insurance begins to pay a portion of costs such as emergency room visits, diagnostic exams, hospitalization, and surgery events. Once a plan member has met their deductible, the next term they need to know is coinsurance. And this is the percentage of eligible medical expenses that is shared between the plan member and the insurer, again after the plan member has met their deductible. Out-of-pocket limit. This is the maximum a plan member is responsible for in a calendar year of any eligible medical expenses. So that includes the deductible, co-pays paid after the deductible, and the coinsurance percentage. Once the out-of-pocket limit is met, the insurer pays 100% of all eligible medical expenses incurred during the calendar year for that plan member. With the Regions Blue Shield of Idaho plans, you are provided two network options. The first network is St. Luke's Health Partners, which includes St. Luke's, Salzer Medical Group facilities, and Primary Health Medical Group facilities and doctors. The second network option is the Regions PPO, which includes the St. Luke's Health Partners that we just reviewed, plus the additional hospitals and facilities in Idaho, as well as the Blue Network throughout the United States. Here are the four St. Luke's Health Partners plan options and a singular Regions PPO option. These are the plans that are available to you in the 2023 benefit plan year. The first row simply tells you which network it belongs to. Second row tells you what plan type it is, whether it's a copay first plan or a deductible first plan. Depending on whether it's a copay first or a deductible first plan, it'll also tell you whether it's an HSA eligible plan, which is a health savings account. Deductible row, coinsurance row, every plan is a little bit different. The annual out-of-pocket maximum for each plan. And then if it is a copay plan, it tells you what the copay is before meeting your deductible for a doctor's visit and mental health or chiropractic and therapy visits. Prescription coverage is a simple yes, and when it's available, your benefit plan summaries will provide you further details, and we'll show you where to locate those summaries for your review. Please pause the screen to look over these plans in more detail. Preventive examinations. All medical plan options that we just illustrated will cover in full at no cost to you specific medical exams, otherwise known as wellness exams. These exams include your annual physical, mammogram, pap smear, blood-specific screenings, and immunizations. Please review your plan summary for further details on all the available and eligible preventive medical exams. All plans also do include telehealth, Regence uses the partner Doctor on Demand for the telehealth services. Telehealth is there for medical and behavioral health care needs. Basically, Doctor on Demand provides convenient access 24/7, 365 to a doctor or therapist via video chat. They can treat common illnesses such as allergies, ear problems, infections, pink eye, sore throats, UTIs, etc. Many of the common things that we had visited an in-person doctor for. Underneath behavioral health, they can help treat addictions, depression, grief and loss, stress management, and more. So when you're using Doctor on Demand, you'll connect with a board-certified doctor or therapist who can diagnose and treat for non-emergency medical conditions, non-emergency mental or behavioral health needs. They can prescribe medications and send those medication prescriptions to your pharmacy of choice. Doctor on Demand is a $10 copay for a virtual visit. If you're enrolling in a copay first plan, that $10 copay is available to you before you meet your deductible. If you're enrolling in the HSA deductible first plan, the $10 copay is available to you after you meet your deductible. Here's the same plan lineup, also now illustrating the weekly pre-tax payroll deduction based on the plan that you choose for employee-only coverage. We'll show you where you see the additional tiers of coverage to add spouse, kids, or the entire family to any of the plan members in a screenshot in the future. Regence additional benefits included in your plan. Employee Assistance Program. The Employee Assistance Program helps you with support of life challenges. EAP offers free access to many services and discounts on other, so confidential counseling, up to 4 counseling sessions, either face-to-face, on the phone, or video chat for issues relating to relationships, work stress, and other common challenges. 24-hour crisis help, online consultations, peer support groups, and additional services. This is all part of any plan that you choose, and it is of no cost to access many of the services. Second value add to the Regence plan will be member wellness incentive. Basically, Regence will reward you with a $100 gift card that you can use at a retailer of your choice for going through a couple of steps to provide information that's helpful for you, but also helpful for the insurer. Step 1 is completing a health assessment. Once you enroll in your medical insurance plan, you'll receive a subscriber or member ID number. You'll use that number to create your Regence member account. Once you log into your member account, you go to the dashboard and you select health assessment. Complete the health assessment, and first step is completed. Step 2 is complete a biometric screen. This you can do at an in-person Quest Diagnostics lab, or you can do through a request for a home test kit. Either way, once those are completed, that information will be updated to Regence, and then when updated, you'll be able to redeem your points within your member portal. So please do take advantage of this. It is available within the first 120 days from the time of your enrollment. Prescription Savings Plan. Now, this particular benefit is separate from your medical insurance plan. We partner with our prescription partner, CleverRx, to help deliver to you additional savings on prescription drugs. We simply just don't want you to overpay on prescriptions. Download our mobile app to unlock the exclusive savings. Once you've downloaded the app and entered the group ID and member ID number, which is on your benefit website, you simply type or speak the prescription name into the app when you have a prescription to be filled. It'll populate a list of pharmacies nearest you for savings. You select your pharmacy of choice, whether it's convenience, savings, or your preferred pharmacy, and present the RX savings voucher to your pharmacist. 40% of generic prescriptions are less than $10. On many of your medical insurance plans, generic prescriptions will be $20 to $25 or higher for the same prescription. So please do yourself the financial favor, spend the extra 60 seconds to look the drug up through the app and discover your savings. Your additional benefits, short-term disability, accident, life, dental, and vision, will all be through Principal as part of the ProTouch Cleaners benefit package. Short-term disability. Short-term disability is your paycheck protection. You work hard for your income. We want to help make sure that if you suffer an off-the-job injury, you have an illness, or even a maternity event, that you will be able to have a portion of your income replaced to you. The income benefit is 60% of your gross monthly earnings, paid to you on a weekly basis. The benefits are payable on the 15th calendar day after your disability begins. What this simply means is that the first 14 calendar days you are covering yourself with your savings, paid time off, sick day, or last paycheck. Once the 15-day begins, you're eligible to receive the weekly benefit up to a maximum of 11 weeks per disability event. Now, there is an exception to this with maternity. Maternity disability duration is either a 6 weeks for a normal delivery or 8 weeks benefit for a C-section delivery. The income benefit is paid to you in a lump sum for the maximum of those times versus paid to you weekly. When you're in the benefit enrollment platform, simply click Enroll on the short-term disability plan option, and it will populate for you your weekly disability benefit. And then over on the shopping cart, it'll show you, based on your weekly disability benefit, what your cost per paycheck is for that specific benefit. Term life insurance. Employees have the option to purchase term life insurance through payroll deduction. So it's very simple. No tests, no exams. Simply state that you want the benefits, answer a few health questions, and it'll be submitted to the insurer for approval. Employees can purchase up to $100,000 in term life. They can add their spouse at $20,000, and each child under the age of 26 at $10,000. If you are a new eligible employee, it is a guaranteed approval up to the dollar amounts we showed on the previous slide. If you're a current employee, previously eligible, and if you waived coverage previously, you can still enroll. You will just be required to answer a handful of health questions for approval of your policy amount. Please note that this is a term policy that has 5-year age bands. So when you hit a new 5-year age band, the rate on your policy may change. So just be aware of that if you have a rate change within the first 1 to 5 years of having this term policy. If you do retire or change employer, you can convert this term life insurance policy to a permanent individual policy through Principal. You simply just need to work with Principal within 30 days of your separation from employment. As an example, when you're in the enrollment platform, you will click Enroll, select through the drop-down menu the amount of coverage that you choose, and over on the shopping cart again, it'll tell you what that cost is for that coverage amount that you choose. So you can choose a coverage amount that fits your budget, or choose your coverage amount and your budget will be shown for you here. Accident insurance. What is accident insurance? Well, if you were to have an injury, the Principal accident insurance is going to pay you a cash benefit amount for the diagnosis of specific injury events, and this would be covered by either anybody in your family that is on the policy with you. Also note that the benefits paid to you do not impact your medical insurance coverage or any other insurance covering that injury. So here's an example. If an employee has an upper arm fracture and it is simply casted or splinted to repair, there's a $1,500 benefit payable. If it requires a surgical repair, there's a $3,000 benefit payable. Similar example, if there's a lower leg fracture, the employee would receive a $2,500 benefit for non-surgical repair and a $5,000 benefit for surgical repair of that bone. These dollar amounts are your dollars. They'll be direct deposited to your bank, and you do with that money as you see fit. Here's an additional example of dollar amounts and different types of injuries that your policy covers. You're welcome to pause the screen to review this in further detail. Accident policy is a variable affordable policy. As you see here, just under $5 a paycheck for the employee-only coverage, just over $12 a paycheck for family coverage. Dental insurance. In-network dentists, there are hundreds of in-network dentists within a 30-mile radius of Boise, so you should have very little issue finding an in-network dentist to provide you with quality care at your plan's best pricing. The basic benefit summary for your dental plan is as follows. You have an annual benefit maximum of $1,000 per member enrolled. Preventive services, your plan covers that at 100%, so you pay nothing for routine exams, cleanings, and basic x-rays. The annual deductible on your plan is $50 per member with a maximum of $150 per family. Basic services include fillings and sealants, root canals, extractions, oral surgery. After the deductible, you pay 20%, the insurer covers 80%. Major services, crowns, bridges, dentures. After the deductible, you pay 50%, and obviously principal covers the other 50%. Please do note that your $1,000 annual maximum is what is being drawn from when you're covering your preventive, basic, and major services. The good news also is that your annual maximum benefit has an accumulation feature, meaning that if you do not use more than 50% of your annual maximum benefit in any given calendar year, your plan can roll over 25% of your annual maximum benefit to the next calendar year. So in this case, as you see in year one, the maximum benefit is $1,000. You have a claim limit of $500. In this scenario, benefits paid were $450. Therefore, you get a $250 rollover amount. And here's your accumulation amount for the next year. And you can see that this scenario in year three also goes again. And now you see an additional $250. So now in year four, you have a $1,500 annual maximum benefit. So it's just a great feature to get more out of your dental plan. Employee rates per paycheck on the dental start at just over $6 a paycheck for the employee and just over $23 a paycheck for the entire family. Vision insurance, also through principal, utilizing the VSP network of providers. Your basic benefit summary is exams, you pay $10. Lenses, you pay $25. Frames, you have a $130 allowance plus a discount above the balance. Contacts, you also pay a $25 copay. Just note that eyeglasses and contacts are not coverable in the same plan year. So you'll simply need to choose which is the better benefit for you in that any given plan year, whether it be having your plan provide more discounts and lower costs for your eyeglasses or more discounts and lower costs for your contacts. Your benefit period is every 12 months based on your initial service date. So if you're enrolling in vision benefits, we recommend that you use your benefits as quickly as possible once eligible. So therefore, your 12-month anniversary starts sooner and you can use your benefits again the next year. Employee costs for the vision benefits are very low, less than $2 a paycheck for the employee, less than $6 a paycheck for the entire family. That concludes the overview of the benefits. Now we'll go on to the next steps. What do you need to do as an employee to complete your benefit elections? Basically letting ProTouch cleaners know which of these benefits you will be enrolling in or which you will not. Either way, you'll complete the benefit elections. So first, review your benefit information, and we'll take you here shortly to your benefit website to show you how to view all your benefit information. Contact 208 Benefits with any questions or advice needs on which benefits you should take on for you and your family and which medical plan might be the best fit for you. And third, complete your benefit elections online. So now let's go over to your benefit website to show you where you can see all your benefit information and then access the enrollment platform. Well, welcome to your benefit website. This is a benefit website specifically made for ProTouch Cleaners employees. As you scroll down the website, you will see multiple tabs that have different types of information available for you to review and to access. The first tab is the View Benefits tab. It simply outlines what your benefits plan year is, your open enrollment period, and then an interactive tiles that review each benefit in more detail. So as an example, you click on the Regions tile for your medical insurance, and here you'll see the group number, phone number, email address, and then your member login to Regions. Your member guide, the benefit summaries for the 5 plan options are all right here for your review as you consider your plan options, but also for refreshing and as you need it through the plan year. There's a provider search, prescription drug list, all right here in a convenient location so that you have this information at your fingertips. There's a video here that simply walks you through the Regions member experience as far as how to access the online portal and the mobile apps. You'll also see your virtual healthcare benefit, video, benefit flyer, and then the downloads for the mobile apps themselves. You will see here your short-term disability link that has, again, the benefit summary, a video, the group number for your policy, and then how to start a disability claim, which is simply an online process step by step. All the information that you need to manage each of your benefits are right here in this benefit platform. Your dental as an example, video about dental insurance, your specific benefit summary, and then if you need to find a dentist, you can simply search for the dentist here, plug in your zip code, and it simply shows you now there's a list of all the dentists that were within your area. You can use the filter to narrow it down and to even search for a specific dentist by their last name. Same goes for revision policies. So all these benefit tiles are interactive for you to be able to access more benefit information, learn about them to help you make your benefit election decisions, but also to help you manage and get the most out of your benefits during the benefit plan year. The next tab will be the benefit pricing. So all the information as far as what is the cost for the different levels of coverage, yourself and spouse, yourself and kids, or you and the whole family, depending on which medical plan or other benefit that you choose. Short-term disability and life insurance do vary by age and income or the coverage amount that you're electing. Once you've reviewed your benefit pricing, your next step is to go to the Enroll Benefits tab, follow the instructions here. ProTouch Cleaners HR will help you also navigate this. You can watch the video here that simply explains to you how to navigate. And you can walk through each step here, updating your profiles, adding your dependents, selecting your benefits, signing any of the forms that are required, and then doing the completion at the end. Once you've reviewed the video in a full screen format to help you understand how to work it, simply go to Benefits Enrollment, and now this is where you log in. If you're a first-time user or if you've forgotten your password, simply click Forgot, enter your email address, and then click Submit. That'll send a reset password or create a password link to that email. If you do not receive this email within about 5 minutes, please contact your HR to make sure that you have the correct email address in your benefits profile. Now that we've reviewed your benefit information website, just the last piece of housekeeping. Your enrollment deadline, if you are in open enrollment, is to be completed by Wednesday, November 30th. If you're viewing this as a new hire employee in 2023, complete your benefit elections, that means enroll or waive, by the 15th of the month prior to your benefit eligible date. HR will help you identify your benefit eligible date based off of your date of hire. Thank you, ProTouch cleaners, and happy benefit elections.